Hi, we're here with Dr. Wade Weaver from Florida Cancer Specialists to talk about skin cancer, and we invite you to do the same today during our web chat. Dr. Weaver, we've heard all the warnings about being in the sun, using tanning beds, and making sure we have sunblock on. With all of that, is skin cancer still something to be concerned about?
Well, it's still the most common cancer we see. Most of the skin cancers are non-melanoma type and are easily treated, but they can also be easily prevented with the use of sunblocks. And we do have large studies now demonstrating that non-traditional or indoor tanning does increase the risk of skin cancers, both melanoma and non-melanoma types.
Wow. What about them being curable, either of the types of cancer for skin cancer?
The non-melanoma types are when identified early, are easily treated with local therapies. We still recommend, obviously, prevention. Melanoma skin cancer, much more challenging to get that same effect.
And have you been developing new technologies, new techniques, new ways of treating both types of the skin cancer?
Melanoma skin cancer has been a lethal cancer and remains such, and it's been years since we've had any new therapies. However, in the last 2 to 3 years, we have had 2 new agents approved by the FDA. They are targeted therapies, so they're often well tolerated by patients, but it also is dependent upon the melanoma having that target that these therapies are directed against. But they have generated some almost magical responses in a subset of patients. But it's still a very lethal cancer, and we feel very strongly about the role of prevention.
And getting checked regularly.
Correct.
Absolutely. If you have any questions for the doctor, Dr. Wade Weaver from Florida Cancer Specialists, we invite you to either phone or email in today during our web chat, because it's not as simple as you think.